So, you've had a C-section before. Does that mean it's your only option for future births? It's a question on the minds of so many expectant mothers. Today, we're going to dig into that. Is a vaginal birth really possible the next time around? Let's get into it.
We've all heard this, right? For decades, this phrase was basically gospel in the delivery room. It's a powerful statement that really set the expectation for millions of women, often making a repeat surgery feel like the only choice.
Well, things have definitely changed. Modern medicine tells a much more nuanced story. The whole conversation has shifted from "you must have another C-section" to a really carefully managed process. It's called a trial of labor after cesarean, or TLOC for short, and we're about to unpack exactly what makes this even an option.
The chance to have a vaginal birth after cesarean, what we call a VBAC, isn't just a flip of a coin. Its success, and more importantly, its safety, pretty much boils down to one single, crucial detail from your last surgery.
Okay, so it all comes down to the scar on your uterus. Look at the left side. That's the modern standard, a horizontal cut made low down on the uterus. This part isn't as muscular, so it heals into a really strong scar. That's what makes a VBAC trial possible. Now, on the right, you have the old-school classical cut. It's vertical, and it's on the upper, more muscular part of the uterus. The risk of that scar rupturing is just too high. We're talking up to 12%. That's why, if you've had a classical incision, a trial of labor is completely off the table. It's a strict no-go.
And I think this quote just nails it. A VBAC isn't about proving you can do something or hitting some kind of personal goal. It's about your medical team looking at all the facts, calculating all the risks, and figuring out what the absolute safest path is for you and for your baby. It's all about the science.
So, what does that calculation look like? You can think of it as a kind of success equation. Let's break down the different variables that your doctor will look at to see if you're a good candidate for this.
And before we get into the details, let's start with the good news. For women who are considered good candidates, the success rate for VBAC is really high, somewhere between 60 and 80%. To put it another way, about 3 out of every 4 women who fit the criteria and give it a try will successfully have a vaginal birth. Those are pretty great odds.
So, who are these good candidates? Well, there are 4 things that are absolutely non-negotiable. First, like we just saw, you have to have that low horizontal scar. Second, the reason for your first C-section is a big deal. If it was for something that's unlikely to happen again, like your baby was breech, your chances are way better. Third, you need enough time between babies, at least 18 to 24 months. That gives the scar the time it needs to heal and get as strong as it's going to get. And finally, and this one is so important, the hospital you choose has to be ready for an emergency C-section, anytime, day or night. That means a full team on standby and a blood bank ready to go. If a hospital can't guarantee that, then a planned repeat C-section is really the only safe way to go.
Okay, so let's say you check all the boxes. The next step is the trial of labor itself. Now, it's really important to know that this isn't some passive, let's just wait and see what happens kind of thing. No way. It is a very active, highly managed, and super closely monitored event from the second you walk through those hospital doors.
The whole process is managed in 3 key ways. First, doctors really prefer for labor to kick off on its own. Using drugs to induce labor can put some extra stress on that old scar. Second, your progress is literally plotted on a graph called a partogram. If things start to slow down or stall, that's a clear signal to the team that it's time to pivot and move to a C-section. And third, you can absolutely get an epidural. Modern epidurals are fantastic. They give you amazing pain relief, but they don't hide the warning signs of a potential problem.
Now, we've got to talk about the one big risk that all this careful monitoring is designed to catch. It's called uterine rupture. And what that means is the scar from your previous C-section tearing under the pressure of labor contractions.
Now, that sounds scary, and it is serious. But let's put the risk into perspective. It's really, really low. It only happens in about 1 in every 200 women who try, so just 0.5%. The entire safety plan is built around spotting the absolute earliest signs of this very rare event.
And the key to spotting it is this incredible early warning system, the continuous fetal heart monitor, or CTG. You see, often, the very first clue that the scar is under stress isn't pain, it's a change in the baby's heart rate. This lets the medical team jump into action immediately, way before the situation escalates.
So with all of this information on the table, you're looking at a choice between 2 totally valid medical options. This isn't about one being good and the other bad. It's about you and your doctor weighing 2 different sets of risks and benefits to see what's right for you.
Let's just quickly look at this chart. In that first column, a successful VBAC. That's the outcome with the lowest overall risk and the quickest recovery. All the way on the other side, you've got a planned repeat C-section. You skip labor and the risk of rupture, but you have the standard risks of any major surgery. And then there's that middle column, an unsuccessful trial that ends in an emergency C-section. The baby is delivered safely, which is the main goal, but this outcome has a higher risk of things like infection than a calm, planned surgery would. Understanding these possibilities is half the battle. The other half, especially if you're trying for a VBAC, is knowing exactly what to look for when you're at home.
And this is so important because when things start to go wrong, the window to act can be incredibly small, sometimes just a matter of minutes. So you absolutely have to know the signs that mean stop everything and go to the hospital right now.
Okay, listen closely. If you feel a sharp, constant pain right on your old scar, especially when you're not having a contraction, if you see any fresh, bright red bleeding, if your contractions were strong and regular and then they just stop, if you notice your baby isn't moving nearly as much as usual, or if your water breaks, any single one of those signs means it's time to go to the hospital. Don't wait, go immediately.
At the end of the day, deciding whether to try for a VBAC is a really personal choice, and it's one you make as a team with your doctor. It's a path that's grounded in science and managed with extreme care, all with the same goal: getting your baby here in the safest way possible. So the real question is, now that you have this information, is this a path you feel ready to explore? And that's the conversation to start with your doctor today.